Hello everyone, this is Dr. Vivek R from Yenepoya Homeopathic Medical College and Hospital. Today we are going to discuss on the topic of homeopathic prophylaxis. Today's specific learning objectives are: at the end of this session you will be able to define prophylaxis, define homeopathic prophylaxis, explain stalwarts' opinions on homeopathic prophylaxis, to know different approaches to homeopathic prophylaxis, to know about prophylaxis before birth. Definition: a prophylaxis is a measure taken to maintain health and prevent the spread of disease. Etymology: it is basically derived from the late 17th century from English word and Greek words pro and phylaxis, which means before and the act of guarding. It is basically derived from the modern Latin word prophylaxis. And basically there are two types, primary prophylaxis and secondary prophylaxis. Even though we know by definition there are many other types and levels of prevention, but for this topic we can consider only two types, that is primary prophylaxis and secondary prophylaxis. Primary prophylaxis means to prevent the development of a disease, that is before a disease has been developed we will be preventing it. Secondary prophylaxis means the disease has already developed and the patient is protected against worsening of this process. It means a person has already got affected by a disease, but we are trying to prevent the further complications through treatment. So, for this topic we are going to focus only on primary prophylaxis and secondary prophylaxis. The other levels do include primordial, secondary, tertiary and also quaternary prophylaxis. Now coming to the topic of homeopathic prophylaxis. By definition, it is the systematic use of homeopathically potentized substance to prevent the development of the characteristic symptoms of the disease or any infectious disease. Basically, we are trying to prevent or stop any disease from development or progressing the disease development by use of homeopathically prepared medicines. This is called as homeopathic prophylaxis. Now coming to the concept of prophylaxis on behalf of Dr. Samuel Hahnemann. So, Dr. Samuel Hahnemann is the founder of homeopathic system of medicine and he himself is the first person to explain the concept of homeopathic prophylaxis. So, during his Hahnemann's times, the concept of or the idea of prevention or prophylaxis was basically at a rudimentary stage and it was not that much developed. They were focusing more only on treatment of diseased individuals or sick individuals, whereas Hahnemann, even during those days, he understood the importance or significance of prevention or prophylaxis and he gave a very clear-cut definition and also methods and the procedures on how to use homeopathic medicines for the sake of prevention and prophylaxis of diseases, both infectious and non-infectious, and that is the specialty of Dr. Samuel Hahnemann. And this we can understand easily even from Hahnemann's fourth aphorism, where he has insisted a physician must not only be a protector from the sick, but also he must be a prevention, he must also be a preventer to prevent diseases from occurring or beginning. In the fourth aphorism, he is explaining about the preserver of health. He can insist the physician to be a preserver of health rather than just being a doctor who just treats the diseased individuals. So, now coming to the examples from Hahnemann's writings. During Hahnemann's time, Hahnemann has used homeopathic medicines in lot of cases where he has successfully prevented diseases from spreading, especially in cases of epidemic diseases. So, we will see the examples. In 1799, scarlatina epidemic was in vogue in Germany and Hahnemann was able to successfully prevent the spread and also he was able to treat some cases by the use of homeopathic preparation of belladonna. And in those days, prevention of epidemic diseases was not possible and the concepts were not that much developed and there were no preventive vaccines or anything. So, it used to be a lot of mortality was very high those days, but with the use of belladonna, he was able to reduce the mortality and morbidity to such a great extent. Similarly, in 1808, he was able to use aconite successfully in preventing another epidemic of scarlatina. We could observe that he has used two different set of medicines in these two epidemics, which is in line with the homeopathic concept of individualization. Even epidemics needs to be individualized every time. We cannot use the same medicine which was used in the previous epidemic for the current epidemic or future epidemics. In 1808, based on his experiences on the previous two epidemics, he published a paper, Observation on the Scarlet Fever, in which he described the individual features of the two previous epidemics and how the selection was made. In 1813, Hahnemann mentioned in his chronic diseases about the use of bryonia and rust dogs for the acute miasm of typhus. So, these are some instances, and another very important instance is where Hahnemann was able to prevent and also cure the condition called as Asiatic cholera. So, this disease was a very dreaded disease during Hahnemann's time, and the mortality was so high that a person who has got affected with Asiatic cholera was almost can be decided that he will be dying. But in such a situation, he was able to choose based on the prevailing epidemic. He and gave the three medicines, namely cuprum, camphor and veratrum album, which was used so successfully for the prevention and also for the treatment of Asiatic cholera. So, these are some of the examples which we have observed from Hahnemann's writings. Now, we are going to see what James Tyler Kent has spoken about homeopathic prophylaxis. According to James Tyler Kent, the great homeopathic prophylactic is always a correctly chosen homeopathic remedy. As we all know, the homeopathic medicine is always chosen based on the individual constitution or the individualized features. Basically, our homeopathic medicines are tailor-made medicines by considering the person's mind and also physical symptoms. So, the one best suited to the general nature of the sickness is the best homeopathic remedy for any case of disease or even for prevention. So, one special point that Kent tells in relation to the homeopathic prophylaxis in selection of medicines for homeopathic prophylaxis is less degree of similitude is sufficient than what is necessary for curing. So, basically what we do for curing diseases, we collect the symptoms of the patient and we form a totality, and we try to select a medicine which is covering the totality as much as possible. So, we try to select the most similar medicine possible so that we can be able to cure the disease on the basis of law of similia. But in cases of homeopathic prophylaxis where prevention is the aim, Kent mentions that it is need not be so much similar, it need not be the medicine that we are going to administer for the sake of prevention, need not be as similar as that as we cure the diseases. So, some level of similarity, partial similarity might be sufficient for giving a protective effect in cases of homeopathic medicines used for the sake of homeopathic prophylaxis. So, now coming to the concept of Boyninghosen on homeopathic prophylaxis. So, he tells about his experience of using homeopathic medicines in the prevention of smallpox. He has very clearly mentioned in his writings that on his experience by using thuja as a preventive medicine for smallpox, he was able to observe that none of the members in the family had got smallpox after taking thuja. So, this has been the experience of Boyninghosen. So, now we had discussed about three stalwarts, basically Dr. Samuel Hahnemann, Dr. James Tyler Kent and Dr. Boyninghosen. Now, we are going to look at the different approaches that are possible towards homeopathic prophylaxis or prevention with the help of homeopathic medicines. So, basically we can divide or approach homeopathic prophylaxis on 5 types. The first one is constitutional remedy, then second one is generic similarity, third one is no-sorts, fourth one is genus epidemicus, and fifth one is homeopathic vaccination. Constitutional remedy. So, as we all know, what is constitutional remedy? A remedy which is chosen based on the mental features and the physical features and considering the past history, family history and the miasmatic history of the individual. This is what we call as a constitutional remedy. And constitutional remedy has been known to be very effective in treating multitude of diseases ranging from just communicable diseases or non-communicable diseases, from diabetes, cancer or any sort of skin infections or n number of diseases. So, in fact, this is the basic concept of homeopathic prescription, that is constitutional remedy. So, Pierre Schmidt says that the constitutional remedy given in the early childhood is the ideal or the best way to protect the baby or the child from future issues or diseases or even communicable or non-communicable diseases. So, this claim is made on the basis that when a person is made healthy by use of homeopathic medicines at an young age, it naturally improves the immunity of the individual also, and also prevents even non-communicable diseases from developing. And how this is happening is yet to be discovered, but still it has been observed in a number of cases and a lot of researches are being undertaken in this same concept. So, this is the first and basic method by which we can effectively prevent diseases from occurring, both communicable and non-communicable diseases. Next is using generic similarity. According to this approach, a medicine is selected which has a general similarity to the disease in question. There is no individualization of epidemic and selection is based on common symptoms. So, as we all know, already we have seen, even as Kent says, in case of homeopathic medicines used for the sake of prevention, we need not select a medicine that is exactly similar to the disease condition, but in fact a partial level of similarity is sufficient to prevent the disease from occurring in an individual. So, this concept is used in case of selection of generic similarity. So, this can be easily understood if we see some examples. So, examples include use of pulsatilla for measles, then drosera for whooping cough, then belladonna for scarlet fever, and lathyrus sativus for poliomyelitis. So, all these medicines, if you look at their pathogenesis or in their materia medica of that particular drug, we can easily observe that it covers the general features of each of these disease condition listed. For example, in pulsatilla, measles is often naturally covered under the pathogenesis of pulsatilla or the materia medica of that drug. So, we can naturally try to use these medicines in the treatment or prevention of these kind of conditions. So, this kind of approach is called as generic similarity. Next, by the use of nosodes. So, what are nosodes? Nosodes are medicines that are prepared from the diseased agents itself, and they are potentized and for the purpose of use as homeopathic medicines. In fact, we all have known nosodes are very deep acting medicines and are used for mainly for anti-miasmatic purposes, but even they can be very successfully utilized for the purpose of homeopathic prophylaxis. In this method, specific disease nosodes are used in the prevention of corresponding diseases. So, this is like for example, if a particular disease is produced by a particular causative organism, then the same disease producing organism can be potentized and can be used for the purpose of preventing of that particular disease. So, for example, morbillinum can be used for measles, and variolinum can be used for smallpox, and influenzinum can be used for influenza, and diphtherinum can be used for diphtheria. Of course, we all know that smallpox and diphtheria are very rare, and smallpox has been known to be eradicated from the world, but still in the past these are the experiences that has been shared by the stalwarts in homeopathy. So, basically we can understand that the most simplest example can be taken as influenza or flu, which is a common flu. We all know that viral fevers or viral conditions are there everywhere. So, in prevention we often use in practice also influenzinum, so which can give effective immunity to the persons who are exposed to the condition but has not yet developed the disease. So, this is called as use of nosodes. Next one is a very important method, that is called as genus epidemicus. This is the correct method which Hahnemann has explained to be used for the purpose of identifying medicine that can be used for any particular epidemic. Okay. Genus epidemicus usually denotes the remedy similar to the totality of the symptoms found in the majority of patients suffering from an epidemic disease, which will cure the disease as well as prevent its occurrence in the healthy. So, what is this? Basically, when an epidemic is going on in a particular place, we all get to see the cases, we will get to see number of cases, and as we collect each individual case as per the homeopathic principles, we will be able to observe that most of the cases are having a very common totality. That means the symptoms, even the uncommon symptoms and the common symptoms are going to be very similar among the number of cases. So, after observing a good number of cases, we will be able to come to a conclusion. So, these are the few set of medicines which are covering most of the cases in a particular epidemic. So, based on this concept, we take a large number of people's totality and then we take up or extract the common totality of those out of this particular epidemic, and then we try to understand which remedies cover this particular totality in a maximum way. And based on this understanding and analysis, after referring to materia medica and repertory, we will be coming to a conclusion and choose one or two medicines which we are going to use in the population for both preventive purpose and also for curative purpose. So, preventive purpose, we will be administering the same medicine at fixed intervals at predetermined plan. As a predetermined plan, we will be using these medicines and administering them to the healthy individuals in the community who may be exposed to the pathogen or may not be exposed to the pathogen, but we will be administering it to the healthy individuals, and we will be able to prevent the disease spread in these individuals. Similarly, even in patients who are already suffering from the epidemic, who has got infected already, For them also this particular medicine is often used for curative purpose and it is often very effective. And by this method only even the arsenic malbum was selected for the purpose of prevention in COVID times, and it was found to be very effective, and a lot of studies have been done on this topic, including CCRH was the first one. The Central Council for Research in Homeopathy had suggested arsenic malbum on the same basis by using this concept of genus epidemicus, and we all know how successful this arsenic malbum has been in prevention of COVID. So now coming to the last concept, that is homeopathic vaccinations. This is a relatively contemporary innovation borrowing on the methodology of universal immunization of the allopathes. I think we are all well known about the concept of vaccination, which is widely used, for example like polio vaccination or BCG vaccination, where there is a fixed kind of substance which is administered to a lot of individuals, healthy individuals, and that can be preventing the diseases in future. Similarly, we are trying to use homeopathic medicines in fixed combinations for the prevention of any particular type of disease. So, this is a comparatively newer concept and is still being researched. So, the best example is the BCT program, which was used against Japanese encephalitis in Andhra Pradesh. Okay, it was even promoted by the government of Andhra Pradesh, and it was found to be very effective in preventing the Japanese encephalitis. So, BCT therapy includes 3 medicines, which is belladonna, calcarea carb and tuberculinum, which has to be administered at fixed intervals of 2 weeks duration for all the children in a particular schedule. So, each medicine will be given at every 2 weeks interval in continuous rotation. So, after introduction of this BCT program, in 1999, the incidence and the number of deaths decreased to 343 and 72 in 2000 and 33 and 4 in 2001, and in 2002 it was observed there were no deaths reported on the cases of Japanese encephalitis. So, this was a very successful program which was used, which has used the strategy of homeopathic vaccination concept and which have proved to be useful, and still lot of studies are going on in this same trend even for other disease conditions. So, these are the 5 major types of approaches which we can use towards homeopathic prophylaxis. Now, this is a little more different concept in case of prophylaxis, where we try to prevent diseases from occurring even in an unborn child. So, this is a comparatively a very different concept which I think is possible only with the use of homeopathic medicines. So, this concept is based on the concept of anti-miasmatic treatment in pregnant women. So, Hahnemann suggests that by using sulfur dynamization, sulfur in potentized form, if we are administering to a mother during her pregnant state, it is expected to remove the so-called miasmatic influence in the unborn baby within the womb of the mother, and it is expected to the mother is expected to deliver a healthy baby which is having comparatively better immunity than a child who has not been exposed to the homeopathic dynamizations. So, during pregnancy, mild antisoric treatment, especially with sulfur dynamization, is indispensable in order to destroy the sora both within themselves and in the fetus, thereby protecting posterity in advance. So, this is what Hahnemann says about use of homeopathic medicines to bring out healthy children to this world, and this is a very beautiful concept, and this is possible only with homeopathic medicines, where the child which is going to be born is going to be healthy and going to be immune to a lot of disease conditions, both communicable and non-communicable diseases. With this, we come to the end of this discussion. So, basically we have understood what is meant by prophylaxis, use of medicines or any treatment methods to prevent diseases from occurring. Homeopathic prophylaxis means using homeopathic medicines or homeopathic preparations to prevent diseases, and we had understood the opinions of Dr. Samuel Hahnemann, Dr. James Taylor Kent and Dr. Boynning-Olson about their opinions on homeopathic prophylaxis. Then we had seen the different approaches that are possible to homeopathic prophylaxis. There are basically 5 approaches which based on which we can understand or decide what kind of approach we can take up in the next epidemic or any disease condition. Then we had also observed that prophylaxis before birth is possible in homeopathy. By administering a medicine, sulfur especially, to a pregnant woman, we will be able to bring out healthy children during their birth. So, these are the references. Thank you.